So, good morning, everyone. Uh, on this busy Sunday morning, I welcome you all on the behalf of CVCCon Alpha series. And this CVCCon Alpha series is designed for introduction of any new technology, new modality into the medical field. And today we are going to discuss such a very interesting modality for the treatment of osteoarthritis of knee joint, and that is a genicular artery embolization. So, root of cause, this very important word in anybody's life. And root of cause, this word is more famous and more popular into the engineering field rather than the medical field. But if we find root of cause of any problem, then success is very handy. So today we are going to discuss the root of cause for osteoarthritis of knee joint. Traditionally, what we believe that wear and tear phenomena it leads to the osteoarthritis of knee joint, but it's true. But along with this wear and tear, is another cause is a chronic inflammation. Continuously, this inflammation process going on within this knee joint, and it leads to further cartilage damage, and along with that, the neoangiogenesis occurs. So, what is the neoangiogenesis? Neoangiogenesis is a hypervascularity developed into this due to this chronic inflammation, and this chronic inflammation leads to the new formation of these microvessels, and these newly formed microvessel continuously releasing the cytokines within this joint, and because of these cytokines, continuous destruction of this joint going on. So now, this what is a chronic inflammation basically? So chronic inflammation is a culprit in many diseases, like macular degeneration. Macular degeneration is also a very common disease, and basically there's a continuously inflammation process going on within the retina, and in this retina, is these newly formed these microvessels continuously leads to inflammation and damaging to the retina, and it leads to hampering the vision. And the macular degeneration treatment is also depends on preventing this chronic inflammation. So they obstruct these newly formed microvessels. Not only macular degeneration, Alzheimer's disease, also even these atherosclerotic changes into the blood vessels. These all diseases are witnesses of chronic inflammation. And in this COVID-19 pandemic era, uh, all this there is no antiviral medicine for COVID-19 virus, right? But all this treatment is planned and designed to prevent the inflammatory reaction of the body. So inflammatory reaction is also very important thing. Whether we use a steroid for as an anti-inflammatory, or another medicine like remdesivir, that is an immunosuppressant for COVID-19. All these are basically preventing the inflammatory reaction and cytokine storms creating due to the inflammatory reaction, and it helps us to treat the COVID-19. Similarly, for genicular artery embolization, it is also going to help us to prevent the chronic inflammation into this knee joint, and further damaging the underlying the knee joint. So let's understand first how this genicular artery embolization helpful for osteoarthritis of knee joint. So basic concept of osteoarthritis of knee joint, basically there is a cartilage which is give the cushioning effect between these two bones, and this cartilage gradually erodes and it reduces the joint space, and because of this reduction of the joint space, friction between these two bonds occur, and it leads to the pain. Now pain is a very dominant complaint for any patients. It starts with the morning stiffness, but gradually this pain leads to pain occurs when the movement of the joint, and it pain reduces into the resting positions. Along with this pain, if there's a swelling develop over the knee joint, this is due to the synovial effusion. Some hard swelling is due to the osteophytes, and many these grinding sensation also occurs while we are using this joint. These all due to the osteoarthritis of the knee joint. But in all the patient, dominant complaint is a pain, and because of the pain, there's a restricted mobility of the patient. And if the pain is relieved, then the patient's quality of life is improved significantly. There are many factors which are affecting this disease: aging, weight, definitely genders. Women are more affected than men, and some professional hazards for the marathon runner and athletes, which they are overusing the knee joint. It's very easy to diagnose osteoarthritis. Even the plain X-ray gives lots of information. By recognizing the joint space narrowing, we can diagnose that osteoarthritis process is going on. Even the staging also very accurately done on the plain X-ray. But USG and MRI also very important modality. By using the power Doppler, we can define the hypervascularity of the synovium. Similarly, in MRI, there are lots of other signs which shows there is a chronic inflammation process going on within the joint. So, for osteoarthritis of knee joint, these investigations are very important, and particularly when we are planning for genicular artery embolization, power Doppler and the MRI are the very important tool to define severity of chronic inflammation within the joint. So there are total four stages of osteoarthritis. Grade 1 is a mild one, and grade 4 is a severe one. In the grade 4, there is no joint space, there is no cartilage left. So pain is maximum into a grade 4 stage. Now currently in osteoarthritis of knee joint, the treatment divides into the two parts. One is operative and second one is a non-operative. In non-operative segment, when the patient first complained of pain and morning stiffness into the joint, then we prescribe some medicines for painkiller and cartilage rejuvenation, and also prescribe some physiotherapy and weight loss. See, weight loss is very important. I'm going to describe you why it is more important. And another non-operative treatment is intra-articular injection of steroids or PRP. These injections are really helpful for temporary, but underlying, unless you treat the underlying the etiology, underlying the root of cause, pain is going to recur. And what happened that all these non-operative treatment fails, and only option is operation, that is a total joint replacement surgery. So till date, there is no other option is available between this non-operative and operative treatment. I mean, non-operative treatment, I give more weightage to this weight loss. What happened that if you reduce weight of 1 kg, then it is going to reduce the 4-fold pressure into the knee joint. So by putting the effort of 1x, we are getting the result of 4x. So obesity and weight reduction is important, very, very important into the osteoarthritis of knee joint patient. So in this osteoarthritis of knee joint patients, when the patient starts complaining pain, we try all these non-operative treatment, giving the painkillers and some intra-articular injections of physiotherapy. But at one stage, all these non-operative treatment stops working, and then the only option for the patient till date, that is a replacement of the joint. That's a major surgery, and you are going to lose your nasal joint. Till date, there is no other options available in between this non-operative and operative. But there's a young intervention radiologist, Dr. Yuji Okuno. He is from Japan, and he has published his research first time in 2014, and he has given the hope that genicular artery embolization, it gives relief into pain, and it stops the cartilage destruction within the joint. His first paper published in 2014, and later on many papers published. Recently, one paper published in 2020. All these different papers suggest you of the pain reduction after the genicular artery embolization is 86% and 86% in the first 6 months, and follow up after 3 years also 80% pain is reduced after the genicular artery embolization. So this procedure is very good, successful. So now, what is the reason how the genicular artery embolization works? So let's find out the root of cause. Traditionally, we are thinking that wear and tear is the only culprit for the osteoarthritis of knee joint. If we use more knee joint, then cartilage damage is going to happen. But this is true. But along with the wear and tear, there is a chronic inflammatory process is going on within the joint. Let's understand this vicious cycle. So what happened? That first cartilage damage occur, and because of the cartilage damage occur, this inflammatory process starts within the body. And when the inflammatory process starts, the body releases the cytokines. These cytokines are two types. One which is helping to rebuilding the tissue, and another cytokines is just opposite to it, that is helping to destroying the tissue or the pathogens. In layman language, we can consider that these cytokines or this inflammatory reaction is just like our Indian Army. Indian Army fighting at the border with the enemies, and simultaneously it built the bridges over the river. It built the roads over the into the border area. So balance between these two is very important. Cytokines are two types, but the balance between the bad type and the good type, it's very important. Unfortunately, what happened into the chronic inflammation? Into the chronic inflammation, this neoangiogenesis occurs. What is a neoangiogenesis? That is a newly formed microvessels, and these are very important process of chronic inflammation. That this neoangiogenesis occur, it leads to the hypervascularity into the localized region, and because of this hypervascularity, continuously cytokines released into that region, and these cytokines going to damage further and further the cartilage. And once this cartilage damage continues, it gives another signals for inflammatory response. So there is a vicious cycle going on continuously. And to prevent this cycle, we have to prevent this hypervascularity. So for that, if we embolize these newly formed microvessels, which is shown over here, see these are hypervascular, these are newly formed microvessels. These are main vessels. And here is this neoangiogenesis and the hypervascularity. If we target these vessels, if we embolize these vessels, then this vicious cycle stops. Chronic inflammation process stops within the joint, and it helps to prevent further damage to cartilage. And it is helpful for the process of helpful for stopping the further process of osteoarthritis. There are many studies which suggest you of increased vascularity due to the chronic inflammation, and this process is going on continuously. So selective genicular artery embolization is very important to break the cycle, to prevent the cartilage damage, and it is helpful. So let's see the examples now. So in the first example, there is a patient. Over here we can see there is a mild to moderate osteoarthritis. The joint space is still preserved, but patient has continuous pain since 3 years, and he has taken lots of non-operative treatment, but still patients complaining the pain. Now it's MRI done, and MRI shows here the synovial effusion near the medial condyle of the femur, and at the same side, when selective genicular angiography done, this shows the hypervascularity. So combination of the MRI is a sign of chronic inflammation, and it confirms on the selective angiography. These are highly combination and these are good indication for genicular artery embolization. If this hypervascularity is embolized by small particles, if this vascularity disappears, like in this case post-operatively. So here what we have done is in this case, that is we embolize these microvessels, so hypervascularity disappears. So chronic inflammatory process disappears, it stops over here, so further cartilage damage is stopped. Now in the same patient, there is a graph for the changes of pain score. At the day of embolization, pain reduces the 50% on the same day, and gradually over the period of next few months, the pain is completely disappeared. So, what is the reason of uh, this sudden and sudden reduction of the pain? So, this is very important etiology to understand. Because of this neoangiogenesis, along with these newly formed microvessels, there is a sensory nerves also developed. And when we target these microvessels, when we embolize it, when we obstruct these microvessels, they, along with these microvessels, these sensory nerves which develop with these microvessels, these also destroy. And these sensory nerves are the main culprit to send the pain signals from the joint to the pain. So patients relieved by this pain from the same day, at least 50%. So this is the beauty of the procedure. As I've told you that any osteoarthritis of knee joint patients, basically dominant complaint is a pain. If you relieve the pain from the patient lives a very happy and healthy life with the same natural joint. So genicular artery embolization is a blessing for lots of patients. Now for embolization, Dr. Yuji Okuno suggestive of imipenem as an embolic material. See, there are two embolic materials. One is a temporary and second is a permanent. Dr. Rosil in the follow-up lecture is going to explain you into details. But Dr. Okuno is suggestive of imipenem, which is widely used as an antibiotic. But when these antibiotics mixed up with the contrast, it created 10 to 17 micron particles. And these particles are ideal for blocking these microvessels. In side effect, there is no side effect observed while we are using this imipenem, temporary embolic material. But while we are using this permanent embolic agent, so there is a side effect while we are using the permanent embolic agent. And local skin necrosis or temporary peripheral numbness observed because of the non-target embolization. This is another example while we are taking a shoot into the superficial femoral artery. These all genicular arterial branch appears, but it's very difficult to define the hypervascularity. For that we have to do the selective angiography. Like in here, there is a superolateral genicular arterial branch is selective angiography done, and with this angiography we are able to find out this vascular flux over here. This is a triangular area shows hypervascularity. These are newly formed vessels over here, and patient has a pain in the same region, and MRI also shows this chronic inflammation into the same region. So these are ideal case, and once you embolize these patients with this temporary embolic material, this hypervascularity disappears over here, like over this case, and chronic inflammation stops, and patient's pain also disappears, and patient's quality life also improves without any operation. This genicular artery embolization is very important procedure. It done in the local anesthesia. Patient has to stay for 1 day from morning to evening, and it done with one needle puncture, no cut, no surgery, and you preserve your natural joint. So which are the indications for genicular artery embolization? Definitely, this should be done into chronic pain. The pain should be more than 3 months old, not responding to other non-operative treatment like physiotherapy and medicines. And spontaneous pain, including night pain and race pain, these are the very good indicator for finding out the abnormal new vessels at the origin. So if this complaint is present into the patient, then we can find out. We can say that there is a chronic inflammation process going on within the joint, and these are the ideal candidates for genicular artery embolization. Even the local tenderness over the joint, it also suggestive of this hypervascularity arising from the chronic inflammation. And pain occur during the climbing of the stairs. See, these very important tools, because when the pain occurs while walking on the flat surface, so that is a very advanced disease, grade 4 disease. But while pain occur only during the climbing of stairs, this suggestive of mild to moderate osteoarthritis, and for this genicular artery embolization is very good modality. Definitely young age group patients where the joint, their natural joint preservation is a main concern, genicular artery embolization is really helpful. And for the extremely old age group patient where the surgery itself is a very high risky, for this kind of patient also genicular artery embolization is very useful. And definitely patients who does not want to go for a joint replacement surgery, for them there is a really blessing procedure. They got relieved by pain due to the osteoarthritis of knee joint with this procedure. So now let's see the contraindication of this procedure. Definitely acute pain is not treated by this procedure. Infection within the joint, rheumatic arthritis is not indication for this procedure. Acute traumatic pain is avoided, and severe atherosclerosis changes into the leg vessel, particularly superficial femoral artery, then this procedure should not be done into the patients. So many of my orthopedic colleague friends are asking me, will it replace to TKR? And I always tell them TKR these procedure is helpful for mild to moderate osteoarthritis. So TKR is not going to obsolete. But it's too early to say. Let's see how the future unfolds. But genicular artery embolization is very useful for many patients. And if you ask me what is a single important criteria for the patient selection, so genicular artery embolization is particularly meant for chronic inflammation. So we have to find out the chronic inflammatory process within the joint, and for that, two important tools. One is a tenderness at the side, and in MRI there is a synovitis at the same side. See, these are the two important criteria. If these are present, I would recommend for genicular artery embolization. If we do the selective genicular artery angiography, definitely hypervascularity present in the same area, and if we go for embolization, then patient will improve symptomology. So, in conclusion, we have seen lots of literatures which are suggesting of more than 80% pain relief with this genicular artery embolization. So previously there was no option available between these non-operative and operative treatment, but with promising results of genicular artery embolization, it has given an option for and it has given a good alternative for operative treatment. And particularly genicular artery embolization, it treating the root cause of osteoarthritis of knee joint. So it is going to be very beneficial to all the patients. So thank you so much. And